I guess I could have called my channel My Life After Antibiotics, but some people don't realize that they are suffering from the side effects of antibiotics, which can cause damage to the body and pain. So what's it mean to be floxed by an antibiotic? And how can you avoid it? According to UrbanDictionary.com, Floxed means to have developed fluoroquinolone-associated disability as a result of taking a fluoroquinolone antibiotic such as ciprofloxacin, levofloxacin, or ofloxacin. The Urban Dictionary has several definitions under the word flox, so make sure you also add the ED to get the right definition. How can you avoid being floxed? Take a few moments to learn some basics. First, know that not all doctors are aware of the side effects of fluoroquinolones and that they can be permanent. After watching this video, do a search on YouTube and type in the word floxed, and you will find a lot of people who have been affected, including women, doctors, and strong, young, healthy men. I have heard that some doctors are prescribing antibiotics less often, but I've never heard a doctor say to me, make sure you read the warnings, and if you have any problems, call me ASAP. Who's responsible to warn us? We do get a pamphlet from the pharmacist, so it does look like it's our responsibility. I knew a woman, I'll call her Kate. She took her teenage son to the doctors, and the pharmacist told her to go back to the doctor to get a different script. The doctor had given her son a fluoroquinolone, but the pharmacist said that her son is in sports and he's still young and growing. Kate went back to her doctor, but the doctor took offense and said she would not change the script. I lost touch with Kate, so I don't know what happened to her son. Knowing what I know now, I would have got a second opinion. At least the pharmacist knew to warn her. The medical field as a whole is not paying attention. I'll list these web searches in my description also. Don't take my word for it. Research it for yourself. Besides, websites are always changing. Information is always changing. I can only share my story and make suggestions of what to search for. And some of these articles need permission, so I can avoid that if I don't quote. Type in a Google search exactly like this. What is the definition of being floxed? And you will find several articles on the subject. Next, learn when to take antibiotics so you can avoid them. An ounce of prevention is worth more than a pound of cure when it comes to fluoroquinolones. I believe I could have somewhat recovered, if not fully, if I had known what was causing my problems in the first place. It wasn't a mysterious disease. The CDC website, which stands for the Centers for Disease Control and Prevention, is the best place to learn about antibiotics. Once you're in the CDC website, you could spend hours there. So follow this search exactly. Type in about antibiotic use, then click on it. Read each of the 4 main sections. The fourth is a quiz on antibiotics to test your knowledge. Let me know in the comments how you did on the quiz. Once you finish the quiz and you're back on the page about antibiotic use, scroll down to Patient Resources and Education. Click on Print Materials. These are the easiest ways to get a full grasp of antibiotics and when to use them. Unfortunately, they are hard to see on your phone, so have your laptop close by. Next, scroll down to Healthcare Professional Resources and Training. Click on Educational Resources for Healthcare Professionals. There you will find handouts that you can print and take with you to your doctor. Scroll down further, and there's even a Return to Daycare letter, which is a letter from your child's doctor to your daycare stating your child does not need an antibiotic. Know that any time you have surgery, you will be given an antibiotic. I had basal cell skin cancer removed. I had a D&C after a miscarriage, which led to more antibiotics. I wish I had gotten my medical records to show what kind of antibiotic I was given during surgery. It's too late. The computer systems were changed, and they told me that they do not hold on to records indefinitely. Surgery includes things like getting your teeth pulled, a tonsillectomy, or a C-section. And I was given Cipro during radiofrequency, which is burning of the nerve, but I do not know if that was normal. I had an antibiotic when I got a heart monitor implant after I was diagnosed with Brugada syndrome, but the doctor could not tell me what antibiotic I had. Ask what antibiotic you will have during surgery. If your doctor doesn't know, ask the hospital. And is there an alternative to fluoroquinolones? By all means, get your medical records. Always read the pamphlet that comes with your prescription from the pharmacist. And do a search of it on MedlinePlus to be absolutely certain what kind of antibiotic your doctor has prescribed for you. Remember that fluoroquinolones can be listed under different names. On MedlinePlus, ciprofloxacin, for example, if you scroll down to the brand names, is also known as Cipro. Levofloxacin is known as Levaquin. That's not a complete list of fluoroquinolones. Some of these drugs have been discontinued. If you search MedlinePlus Levaquin, for example, information will show up quickly rather than going into the MedlinePlus website first. Notice the drugs listed all have the letters F-L-O-X, Floxed. We need someone like an antibiotic consultant in doctors' offices and hospitals to educate people how and when to take antibiotics and not to pressure your doctor into giving you one. This will also help with antibiotic resistance. I also wish that people who are suffering with pain after antibiotics were given the correct therapy. A sports doctor told me I had the wrong physical therapy. I made a video showing the correct therapy for me. It's called Exercises and Stretches to Relieve Pain. And I was given epidurals and nerve blocks, which made me worse. And I should have never had radiofrequency. I also had prolotherapy, platelet-rich plasma injections, and acupuncture. Acupuncture helped me the most and gave me some of my life back. And acupuncture is quite affordable. In conclusion, number 1, don't be afraid to ask your doctor if they've prescribed a fluoroquinolone, and if so, to prescribe something other than that. Number 2, if your doctor is unaware of the side effects of fluoroquinolones, please tell them that there are a lot of people who are suffering from the side effects, and it's called being floxed, and some people don't recover. Already have in hand print out materials from the CDC website. Number 3, even if your doctor says it's not a fluoroquinolone, please research it before taking it. You can also ask your pharmacist. Did you know that the pharmacist can hold your prescription for several days or even cancel it? Regardless, research it for yourself to be safe. Number 4, if you do take an antibiotic, take a probiotic also to replenish the good bacteria that the antibiotic kills. Search for, should I take a probiotic with an antibiotic? If there weren't others speaking out about this, I'd be lost. Have you heard of being floxed? Have you been affected by antibiotics, not just fluoroquinolones? Please comment below. Hit like and subscribe to help me raise awareness. Chronic pain is always staring me in the face. Over the years, I've learned a lot of tips that help not only me, but my loved ones too. And they can walk and don't spend days in bed like I do. Join me on my channel.